All right, let's get going. Hello and welcome to our monthly teleconference series. Today's topic is urinary incontinence, brought to you by Northern Westchester Hospital Center for Healthy Living. My name is Margaret Robato, and I'm a registered nurse and educator for the Community Health Education and Outreach team. I'd like to introduce Sonia Thomas and Marcella Denzer. Sonia Thomas is a licensed physical therapist since 1993, earning her degree from Father Muller's Medical College in India. She's been working at Northern Westchester Hospital for the past 15 years. Her passion for learning and expanding her skills and expertise as a physical therapist have led her to participate in an extensive number of continuing education courses and certifications, specifically in women's health, vestibular disorders, and balance impairments. She also has extensive experience and knowledge in treating post-concussive and neurological rehabilitation. Marcella Denzer has been a licensed physical therapist since 1985, earning a degree in physical therapy from SUNY Stony Brook. Marcella has worked at Northern Westchester Hospital for over 10 years and has extensive experience in the rehabilitation of individuals with orthopedic, neurological, developmental delay, and motor disorder diagnoses. She's skilled in the use of manual therapy, therapeutic exercise prescription, and motor development techniques. She also specializes in wound care management and lymphedema management. Marcella has always had an interest in women's health and has participated in an extensive number of continuing education courses, most recently in the area of pelvic floor therapy. Marcella is a certified wound therapist, a diplomat of the American Board of Wound Management, and a diplomat of the American Professional Academy of Wound Management. She's state certified early intervention provider, and she is also fluent in Spanish. Today, we're going to use a question and answer format. So let's get started with the presentation. Welcome, Sonia and Marcella.
Good morning.
Good morning. Thank you.
Good morning.
Thanks.
Thank you. All right. So first question, can you tell me what is urinary incontinence?
So urinary incontinence, it is the loss of bladder control. It varies from a slight loss of urine, even after exertional activities like sneezing, coughing, or laughing, to complete inability to control urination. This urinary incontinence can affect both men and women.
Okay. What is the process of urination?
The process of urination is the releasing of the urine from your urinary bladder. Through a tube called urethra, it comes out of the body. The process starts when the brain sends a signal to the bladder for the muscles to tighten and squeeze the urine out of the bladder. And at the same time, the brain sends a signal to the sphincter so those muscles relax and the urine can exit the body through the urethra.
Okay, so what are the causes of urinary incontinence?
So incontinence can happen for many reasons, and some causes may be one, pregnancy due to excessive pressure on the bladder, two, constipation from overstraining causing a weakness of the pelvic floor muscles, three, medications can cause urinary incontinence, four, weak pelvic floor muscles in altogether, five, any vaginal infections, if there are any, and if there's any nerve damages and diseases like diabetes and MS that connect the brain to the bladder control. Or it can also happen in pelvic organ prolapse patients or individuals. It can happen in enlarged prostate gland and excessive weight gain or obesity, and of course, maybe even due to age.
Oh, lots of different causes. Okay.
Yes.
What are the types of urinary incontinence?
There are different types of incontinence that we addressed a little bit differently. One is the stressed incontinence. The other one where the pressure is excessive and makes you urinate without the control. The urge incontinence, that's the one where you're frequently going to the bathroom, and it has to do in part with the muscles. There's functional incontinence, is the one where there are some functional activities that when you lift some weights that may cause you to lose urine. There is overflow incontinence, which you see more in neurological patients, like when you're paralyzed from the waist down or from the neck down, or when you have multiple sclerosis, you're unable to control the evacuation of the bladder, and it overflows when it's filled to the max. And those people have different techniques to be able to urinate. And there's one that is a mixed incontinence, which you can see a combination of two of any of the types that we mentioned above.
Okay. How do you know if you have a urinary incontinence?
So when urine leaks with exertional activities such as coughing, sneezing, laughing, exercising, or lifting, for example, that's an indication that you might have urinary incontinence. When you wake up multiple times during the night to go to the bathroom and to urinate, that also could be another sign of urinary incontinence. If you need to revoid immediately, or when you have to urinate frequently, multiple times during the day, that might be also a sign. Maybe due to incomplete emptying when you are in the process of urination and you feel like you're not done yet. That kind of feeling that you have, that can also be a sign, as well as when your urine is very slow streamed and you're not able to go to the bathroom very quickly. You need to take a lot of time to be able to even start the process. That could also mean that there are also signs for urinary incontinence.
So it's not just a leaky bladder, it's these other things as well. That's very interesting.
Yes.
Okay. When is it time to have a consult with the doctor?
It varies a little bit from person to person, but some of the things that lead you to go see a doctor for your incontinence would be things like the quality of your daily life is impacted by the incontinence. When you go to the bathroom more than 8 times a day, when you are unable to sleep through the night because you get up so many times to the bathroom because you have to urinate frequently, when you're socially anxious in an event, meaning if you go out for dinner and you're already like trying to find out where is the bathroom, how am I going to get there? Will I be interrupting other people if you're at the movies? Do I need to sit at the edge of the row so I can get up quickly? When you have to use different things, modify your life, that you have to put many pads and you carry the pads with you. Also, when you run to the bathroom quickly and you may risk a fall, or you urinate down to your legs and you wet the floor with your own urine, you can have an accident and with falling. And when you, as a result of it, you wind up with infections, urinary infections. So those are reasons why people will consult a physician.
Okay, thank you. And what type of a doctor would we see regarding this?
So a lot of times the family medicine practitioners and internists can treat bladder problems, but more specifically, urologist, OB/GYN physicians, or a urogynecologist, they specialize in these areas and would be best, physicians to kind of manage your problem.
Okay. And what are the questions that we should ask the doctor?
Some of the frequent questions that people may ask is what foods or beverage are irritants to the bladder, like coffee, chocolate. So one question would be like, how do I modify my diet in order to help with incontinence? How much is a normal amount of fluids that I can take during the day? Is there a reason why I should stop drinking fluids certain hours before I go to sleep so I don't get up so many times at night? Is there any other changes I should make in my daily life? Do I teach myself to go to the bathroom once in the morning and void? and like when the urgency comes to go, do I hold it for a little while until I teach my bladder to go not every hour, but every 2 hours, and you increase it to be a more normal frequency. What exercises can I do to help with the incontinence? Are my muscles weak? Because many times people say, oh yes, do Kegels, but the Kegels are not so simple. It involves learning how to pull the muscles in the right direction. And with that comes, should I really see a therapist that would teach me how to do the contraction, how to do the Kegels, how often, and all of those things, because like I said, it's not so simple. Other things that people ask sometimes, especially in the case of males, is like, does the enlarged prostate affect the urinary incontinence, or does it impact? And so that would be more in the case of males, obviously. And, like we said, what's the normal amount of fluids I should take? So there's different reasons, but those are some of them.
Some of the questions to ask, sure. And what tests are usually performed when you see the doctor?
So there are usually a number of tests that the physicians performs or, assesses. And so some of the things that that I just want to stress is they might do a bladder stress test. And so during this test, you'll be asked to cough or to bear down. And then the doctor or the physician is watching for how much of loss of urine is there, while you're doing any of those exertional or stress related activities, Another test that's there is urinalis. It actually tests your urine for signs of any infection or any other causes for incontinence. So like as we said before, the frequency of infections can also cause urinary incontinence. An ultrasound may be done. So to take a picture of the kidneys, the bladder, and the urethra, and the different structures that kind of take part in the process of urination. Cystoscopy can be done, where the physician places a thin tube connected to a tiny camera to look at the inside of the bladder and the urethra. And last one that we kind of put together was the urodynamics, which again, it's a thin tube that's inserted into your bladder, and then your bladder is filled with water. So then the physician can kind of measure how much of fluid is there and how much of leakage you have. So those are some of the tests that's usually performed.
Okay. And when is the need to see a physical therapist, and why do you need to see one?
Okay, so this kind of goes with the other questions that we answered before. If someone tells you go and do whatever, as many Kegels as you can, which people may say sometimes, you'll be surprised. And when your symptoms are not getting better with a recommendation you may have been given by a physician, a nurse, or whomever else, then that would be a time for you to ask for an evaluation by a therapist. When you're using excessive number of garments, when you're getting irritated in your genital area from using pads that are wet, is there any better method? Maybe you learn to control your muscles instead of holding on to wet garments. When it really impacts your normal activities, like we said before, I mean, do you cough and you have incontinence? Do you go to the supermarket, you lift your bags, and then you're leaking urine again? So those are reasons why you should ask for a referral to be seen by a therapist.
And would any physical therapist be sufficient, or do you have to specialize?
It's a specialized training. There is a sequence of courses you can take. You need to have at least a few basic courses in order to become, someone who can treat. After so many, you can be a certified specialist. But in order for you to treat, you definitely need to have that training, because you have to learn to evaluate the person. And it's a totally different area. It's a very specific in the world of physical therapy.
Right, good to know. What is involved in treating urinary incontinence?
So your doctor or your physician will work with you to find the best treatment for you, but some of the treatments may include behavioral treatments. And what we mean by that is trying to change your behavior a little bit. So like we said before, sometimes there are bladder irritants such as coffee or different types of energy drinks that people may use that might be causing a little bit of the urinary incontinence. So trying to kind of figure that out and trying to avoid those bladder irritants might be one of the behavioral techniques or treatments that we have. Keeping a diary of how many times do you go to the bathroom, or even just trying to time yourself a little bit. Those are some of the behavioral treatments. And so the other thing is medicines can be used for bladder control. Even devices can be used that the physician will recommend for you. So that could be done. In physical therapy, we do a lot of biofeedback. And so that is more like training and the muscles and our brain to kind of be able to contract the muscles in the appropriate time and for our brain to be able to voluntarily, go to urinate or even to kind of hold for a little bit time. So that kind of feedback, we use the biofeedback in order for patients to get a better understanding of that. The treatments can be nerve stimulation. Sometimes we use, maybe even physician might even promote catheterization as well as surgery. But a lot of our physicians will also recommend physical therapy to be able to retrain and to be able to perform appropriate exercises in order to get back to your, level of activity and and maintain an active lifestyle.
Wonderful. And so what can you expect when you're seeing a physical therapist?
This kind of marries with the other questions that we had asked before. And one of the things that you had mentioned is to ask the therapist if they have that special training to perform the pelvic floor assessment and treatment. In that, the actual evaluation is, of course, individual, and it has two parts. It has an external as well as internal. And by our internal exam is different than a doctor's internal exam. We look at the tension in the muscles, the amount of strength you can perform with a specific instructions, the not only outside, but also inside, usually muscles that are related to your hips and other parts of the pelvis. We do a very thorough history of what the problems are and some of the medical history the patient has. We also look at a diary, like Sonia was saying, to know what are the frequencies with what you go, how many pads do you use, and all of those things we put together, and with that, we develop a very individualized program of exercises, behavioral modifications. Like Sonia said, some devices we may need to use a stimulation of electrical stimulation. We may need to use the biofeedback to show the patient visually how much activity they're doing. We also focus on teaching proper breathing technique to coordinate with the exercises you're doing. We definitely focus on posture to keep you aware of how you need to sit in the toilet, to like urinate, to defecate, to do, because we don't only work on urinary incontinence, but we also work on fecal incontinence as well as constipation. So it's really very specific and very tailored to the needs of one patient at a time.
And it really would be wonderful if, I know a lot of people buy these incontinence pads and are walking around, like you said, with, moist undergarments all the time, and that potentially just a conversation with your doctor and a referral for physical therapy could help with all of this.
Yeah, and
Wonderful.
that, speaking of, that leads to infection,
Yes.
skin irritation, skin infection, and
Sure.
urinary infection. It's like it's significant problem.
Yeah, and a whole lot of self-consciousness, I'm sure as
yes.
well, worrying
Sure.
about odor or discomfort and any of that.
Absolutely.
Yeah.
What are the requirements for continence?
So in order to for you to say that you are continent, or you have the continence, so you have to have a strong pelvic floor muscle, strength. So that along with physical therapy or just modifications or just exercise, like she was mentioning with posturally, to change posture and to change the way that we are activating the muscle. So we need to have a strong pelvic floor muscles. We need to decrease the frequency of infections in order to, be required. That's one of the requirements for continence. We need to have an appropriate schedule for urination. So during the day, you should not be urinating like 8 times a day, 8 or more times a day. That is, too much during the day. And you need to have like normal, consistency and timely, even bowel movements that goes along with that. And we should be able to maintain adequate weight to reduce the pressure. And you should have more awareness of your behavior, like in order to limit irritants if there are any, or if there's any particular foods that might be triggering. Even alcohol might be considered as one of the irritants. So to have that awareness, based on your lifestyle, that's some of the requirements for the continence itself.
Okay. And do you have some resources or educational materials we can share?
So there are some of the resources that is found in online if you kind of Google it up, but so they offer education materials as well as go into what does this mean, kind of overview of what is urinary incontinence as well as in males and females. So some of the things that we just, jotted down for anybody to look up that we refer to is the International Continence Society, or even the International Urogynecological Association. They have websites that offer these education materials, or even National Association for Continence. So those are the 3 main that I think have, that we think that we have more education materials and kind of relays the message as to what it is, and it's language that could be understood. But we offer, as we come to physical therapy and patients come to physical therapy, we also provide education materials, individualized, for the patient as well.
Wonderful. Really very enlightening. I had no idea the extent or the different varying degrees of incontinence that there were. So I want to thank you both for your presentation, Sonia and Marcella. It was really terrific information. Thank you. And if we have any follow-up questions, I'll be sure to get to them to you. So thank you.
Absolutely. We'll be happy to answer and help with answering those questions.
Thank you.
Thank
so this
you
brings
for
us
having
to
us.
It's our pleasure. Like I said, a terrific presentation. So it brings us to the end of our session. And again, thank you, Sonia and Marcella, for sharing your expertise with us. And for everybody who tuned in today, I thank you. I hope you enjoyed it as much as I did. And please remember to call in every month on the last Wednesday at 11 a.m. The call-in number will remain the same each time. Next time on October 27th at 11 a.m., we will discuss calming walking with Rachel Merchant. She's a licensed clinical social worker at Northern Westchester Hospital. Thank you all and be well.